Between Grossmont Hospital in La Mesa and Mesa Vista Hospital in Kearney Mesa, Sharp cares for more patients with psychiatric emergencies than any other local provider. Sharp Mesa Vista has 7 different units, including an ICU and an area for children and adolescents. Psychiatrist Michael Plopper is the medical director. He says over the past 20 years, Sharp has generally had good interactions with insurance companies, including Anthem Blue Cross. But Plopper says about 2 years ago, Anthem changed the way it reviewed claims. As a result,
we now have more denied days from Anthem Blue Cross than any other payer. We have more hospital stays here that include denied days by the insurance company than all of our other insurance companies combined.
Plopper shared some denial letters from Anthem. In case after case, Anthem Blue Cross either wouldn't pay for the initial hospitalization or a continued stay because the company determined it wasn't medically necessary. Plopper points out he doesn't hospitalize someone unless it's medically necessary. He says about half of his patients come in willingly, with conditions ranging from severe depression to schizophrenia. He says the other half are admitted involuntarily.
They're admitted against their will. And those would be people who meet criteria for a 5150 or a 72-hour hold, in that they represent an immediate danger to themselves, an immediate danger to others, or they're so gravely disabled as a result of their mental illness that they're unable to care for themselves.
Plopper says since 2010, Anthem has denied payment for 539 hospital days, about 1/3 of all days submitted. As a result, he says an increasing number of Sharp doctors are refusing to treat Anthem Blue Cross patients.
We're down to a very few physicians who will take these patients on admission because the utilization management practices are so onerous and so futile that they feel that it's not worth it to them, and they don't want to be in a position of having a patient in the hospital that they're having to say your stay is no longer covered.
A similar situation is happening at Aurora, a psychiatric hospital in Carmel Mountain Ranch. Medical Director Tom Flanagan used to sit on one of Anthem Blue Cross's medical advisory committees, but he resigned 2 years ago when he noticed the insurer began to deny care for a high number of his patients.
I've been increasingly frustrated with the increasingly arbitrary way that the criteria for inpatient care is applied. I've had to send out patients that I've been very worried about, and I lose sleep.
The California Department of Managed Health Care regulates HMOs in the state. Last year, the agency sent a letter to all insurers. It reminded health plans of their obligations to cover emergency psychiatric care. The letter also spelled out the only conditions under which payment and care may be denied. If the health plan reasonably determines that emergency services and care were never provided. In cases where an emergency provider conducted a screening examination and the enrollee should have known that an emergency did not exist. And for post-stabilization services rendered without prior authorization by a health plan. DMHC officials said they haven't received complaints from San Diego providers and can't comment on specific denials of payment. But the California Hospital Association says it's heard lots of complaints and says the law is crystal clear.
The health plans must provide coverage, and the treating physician, not someone on a telephone, makes the determination of the emergency nature of the individual's illness.
Anthem Blue Cross did not agree to be interviewed for this story. In a written statement, spokesman Daryl Ings said, "When the clinical information provided meets the criteria for the requested services, benefits for the requested service will be certified by the utilization reviewer or care manager. When the clinical information does not meet these criteria, the case is sent to a psychiatrist reviewer. If benefits for the requested services are not certified after this review, Anthem has a formal appeals process that a member or the treating professional can initiate." Dr. Michael Plopper says Sharp has recently appealed 366 hospitalization days that Anthem wouldn't pay for. The company reversed its decisions on only 6 of those days, a reversal rate of 1.6%. The average reversal rate for all of Sharp's insurers is 53.8%. Dr. Tom Flanagan says hospitals still provide emergency psychiatric care, even when insurance won't cover it. But he says that care is limited, and patients are usually discharged prematurely.
They may not go home and kill themselves or somebody else, but they may not get their job back. They may not get well enough to even get back to their job. Adolescents may not go to college when they are clearly candidates for college, but because of their drug abuse or depression, they never get to college. And that's the group that we never get to know about, and it's very difficult to measure, but it's happening.